Oh, all right. Thank you for that introduction. As always, good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. Yet again, we're doing another great show here. Yet again, we just love talking about different topics, different subjects, making sure that everybody gets educated about different health issues that are coming, that are happening around whether it's around the world, around America, or just, kind of more locally. And so today is yet again another day where we have another wonderful topic that we're going to cover. And that is going to be something you may have heard a little bit about, but I think most people don't know a lot about it. And it's something called alpha-gal syndrome. And it's a tick bite that can make you allergic to meat. And so, of course, this is something that people really don't know about. And when you hear about it, it sounds crazy. So today, before we get started, I'm gonna say today we're talking about alpha-gal. And before we get started, let me clear something up. An alpha guy is someone who thinks they're in charge, right? An alpha gal is a strong woman who definitely knows she's in charge. But alpha-gal syndrome is neither one. This is an allergy that can develop after certain tick bites and can make you allergic to red meat. That's right, burgers, steaks, the whole 9 yards. So if someone tells you they have alpha-gal, don't assume they're talking about dating advice or leadership potential. They may be talking about this medical condition that we're going to go deeper into here just this afternoon. Okay, let's see. So really, I mean, I would say about 20 years ago is probably when this became a little more well known, and it's becoming increasingly common throughout North Carolina, Ohio, and and throughout some of the U.S. as well. And just imagine this. Okay, so you've been eating burgers, steaks your entire life without any problems. Matter of fact, you love them. Like, so you've gone and you've eaten 2 or 3 burgers at a time, and you love that's your favorite part of Thanksgiving. One day, or grill when you grill out, one day you develop hives, stomach pain, vomiting, or even a life-threatening allergic reaction several hours after eating meat. What changed? Like, where would this come from? Oh my gosh. So, and the answer may surprise you. It could have been a tick bite. Okay. And so today we're going to discuss this condition called alpha-gal syndrome, ALPHAGAL syndrome. And it's sometimes called the red meat allergy or tick bite meat allergy. And so we're going to discuss a little bit about what it is, where it comes from, why cases are increasing, how to recognize symptoms, and how it gets diagnosed, and and one of the big things is how to protect yourself and your family. So let's get started here. So number one, let's start alpha-gal syndrome. So what is alpha-gal syndrome? Alpha-gal syndrome, often abbreviated AGS, is an allergy, but like hay fever and whole 9 yards. But it is unlike most allergies. Most food allergies occur within minutes. So, like, think about a peanut allergy. You eat the peanut, you get pretty much symptoms, almost instantaneously. But alpha-gal reactions often occur 2 to 8 hours later, sometimes making it difficult to connect symptoms to what you've eaten. Imagine if it's 8 hours later. You may have eaten lunch, you may have eaten a little dinner, and then all of a sudden you start getting these symptoms. So you got to figure out which one it's from. And the allergy is directed against a sugar molecule that's called galactose alpha 1, 3 galactose. You don't have to remember that. Like I said, that's just a full name of what your people who have this syndrome are allergic to. And so thankfully you don't have to remember that. But just remember that alpha-gal is a sugar found in most mammals. So that means, your beef, pork, lamb, venison, goat. All these can, it's in those, and so it can trigger reaction in that. Now, interestingly, chicken, turkey, fish, and seafood usually don't have this molecule, so you tend to not react as much to those. So, when was this found? So scientists first recognized alpha-gal syndrome in the early 2000s. They were noticing some of the cancer patients were having severe allergic reactions to a medication called to one of the medication they have there, and then they discovered that these reactions were linked to an antibodies against this alpha-gal. And then they later connected those antibodies to tick bites. And so there was a leading researcher, Dr. Thomas Platts Meal of the University of Virginia, that was one of the head researchers. And now today, alpha-gal syndrome is recognized across much of the United States. So in terms of some statistics there, the CDC estimates that as many as 450,000 Americans may have alpha-gal syndrome. Most of these cases occur in the Southeast, Mid-Atlantic, and South Central United States. And the Lone Star tick, and that's a tick that they associate with this syndrome, continues to expand its geographic range. So basically, this Lone Star tick is thought to be the culprit for why people develop this, and that Lone Star tick is starting to spread throughout different areas. So a lot of times healthcare providers may be unfamiliar with this condition because it's just now getting out there. And the problem is that, like I said, symptoms may not occur until several hours after eating meat, making the diagnosis a little challenging. Okay. So, all right. So how do you get alpha-gal syndrome? The primary cause is a bite from the Lone Star tick. And as those of you that are watching online, you can see that picture there as a tick, and it's got what looks like what they call the Lone Star. So it's kind of marked there. Okay, so when the tick feeds on mammals and later bites a human, it may transfer substances that trigger the immune system. And the immune system starts producing antibodies against alpha-gal. And then the next time you eat the mammalian meat, your immune system may react to it. So who's most at risk of developing this condition? So you're talking about people who spend time outdoors. Of course, that's where most ticks are going to be, right? If you people that are hunting, people that go camping, if you spend time in a garden, if you go hiking, you work in forestry or live in wooded areas, all those are going to be, of course, because when you're out there, you're more exposed to the ticks, and so those people are at higher risk of getting this. Okay. North Carolina, as I recognize, hot spots, and Ohio cases have increased as tick populations expand. So think about this. Think about how much time you spend outdoors during the spring and summertime, and then ask yourself the question: do you routinely check yourself for ticks afterwards? So that's something that you may not be thinking about in the past, but like going forward, you might want to think about this. So now we got symptoms and diagnosis. So what kind of symptoms do you have? And the thing is that symptoms can really vary. Some people develop very mild symptoms, others experience severe, sometimes even life-threatening reactions. Some of the common symptoms might be hives, itching, swelling, nausea, diarrhea, stomach cramps, shortness of breath, or even dizziness. Now, in the severe cases, you may be talking about anaphylaxis. And anaphylaxis is a life-threatening allergic reaction that requires emergency treatment. Okay. So, but one of the problems is that because these symptoms can happen hours later, people may not suspect the hamburger or pork chop that they were eating earlier. So how is it diagnosed? So the doctors may review your history, ask about tick bites, and ask about delayed reaction after meat consumption to see if you've had this maybe milder symptoms before you showed up to the doctor's office. There are blood tests that can detect antibodies to alpha-gal, and a lot of times people are going to make multiple visits to the doctor before they get the correct diagnosis, because sometimes it's a matter of putting that story together. So one of the myths is that if you eat meat without immediate symptoms, you don't have alpha-gal. The fact is that symptoms may occur several hours later, and they may range from very mild irritation to something severe. So that can make things a little tough to diagnose. Now, in terms of treatment and management, currently there is no cure, and the treatment focuses on avoidance. So most patients must avoid beef, pork, lamb, venison. Some patients may even react to dairy products, gelatin, certain medications, and some medical products derived from mammals. So, so it's again, it's one of the things that's kind of hard to put together sometimes, especially with the milder or non-specific symptoms. Now, for people that are at risk of this or know that they have it, you may want to carry an EpiPen. And what an EpiPen is really kind of an auto injector that releases a medication that can help you, especially whenever you're talking about anaphylaxis, because there's not really a lot of other things you can do when you have anaphylaxis. You got to get that medication into your system. So those people that are diagnosed with this, you may want to make sure that you have an EpiPen. Now, one question: can alpha gal go away? And sometimes, like I said, over time, it may decrease at least in severity, and I don't know if it goes away completely, but like I said, maybe less of a reaction. Avoiding future tick bites may reduce the likelihood of persistent reaction, so you don't want to get multiple bites. So, but if you're getting repeat tick bites, it may worsen the condition. Okay. So, as we talked about, avoidance is what you want to do for this, and prevention. So, this is where lifestyle medicine or preventive medicine becomes important, because in this case, the best treatment is to prevent. So, what are some tick prevention tips? You want to wear long sleeves. If you expect going outside, you want to wear long sleeves. You want to wear long pants. You want to use EPA approved insect repellents. You want to stay on trails, avoid tall grass, shower after outdoor activities. And then, probably the big thing is perform tick. If you have been outside, perform tick checks. Take a look, take a look at arms, things of this nature. Areas on your back, you may have to have somebody else help you out with that. And of course, if you got children and pets, you want to check them to make sure that they don't have ticks. So those are some of the big things that you want to do to prevent yourself from getting bit by ticks. And that is the biggest way to avoid, getting this alpha gal syndrome. Now, whenever you do have to remove ticks, you want to make sure you're using tweezers. You want to grab close to the skin, pull straight upward, and avoid crushing the tick. So I'm sure you can look online to see for examples of how to properly remove ticks, but you want to make sure that you're removing it properly. Right? And think about this, as we talk about this, when was the last time you checked yourself or loved one for ticks after being outdoors? And especially for the folks that go out on a regular basis, actually, maybe even more important for people that don't go out on a regular basis, and then they find themselves out, maybe decide that you want to go hiking somewhere. You want to check yourself and make sure that you're not missing any ticks. So, if you're, make sure you're wearing some longer sleeve, like I said, make sure you're wearing some longer sleeve clothing. Of course, it's summertime, so it's kind of difficult. So you might want to look for something that's a little lighter, lighter, like, not only fabric wise, but also in color wise. So it makes it easier to find. So like, so of course imagine if you had a shirt that was white, it's going to be a lot easier to see that tick than if it's, I think the thing was brown, the little brown tick. So if you got brown shirt on, it's going to be harder to detect. But if it's a nice, nice white or light colored shirt, it's going to be easier to find that. Okay. All right. Now, of course, as always, I know everybody's asking, like, Dr. Brown, you're a kidney doctor. Why are you talking about alpha gal? And honestly, alpha gal does not it doesn't directly affect or cause kidney disease. But of course, anytime you got these things that are giving you diarrhea, stuff of that nature, they can also cause a little bit of kidney injury. So, of course, we want you to avoid that. And so, and like I said, for this show, we just look for ways to make you more aware of different health issues that are going on. And so alpha gal is one that it seems to be increasing. And so this is something I thought that everybody should know. Okay. And remember, the severe allergic reaction can cause dehydration, low blood pressure, and those things can lead to a kidney injury. especially in older adults. Okay. And the interesting thing is, and I know this is probably not what anybody wants to hear, but if you get diagnosed with alpha gal, you have to completely rethink your diet because, yet again, mammalian meat is causing these reactions. So this becomes an opportunity. I'll say opportunity because it's definitely not what somebody wants to do. But then you start looking at replacing your red meat with fish, beans, lentils, nuts, poultry. So basically, you're just decreasing the amount of red meat that you're consuming, and that can be healthy for a lot of folks. Okay, or I guess the alpha gal is its own issue, but like I said, this can help you with kind of avoiding red meat and looking for other sources of protein or other sources um, of food to provide your diet. And of course, this may ultimately improve blood pressure control, cholesterol, weight, and cardiovascular health because there have been studies that show that avoiding red meat can be associated with improvement in cardiovascular health. So patients with hypertension, this often aligns well with the DASH and Mediterranean style eating patterns. So this, is something that, yet again, I'm gonna give you information you need not to get alpha gal, but if you do get the alpha gal syndrome, like I said, these are some things that you can do to try to help. What would be a good word for this? To try to help make the best of that opportunity and to minimize the chances of you having reactions to your food is to look for kind of a whole food plant predominant diet. Now, so when you're talking about these syndromes, of course, rural communities are going to experience greater tick exposure because of the way you work, the way your recreation, and the geography. And the awareness, unfortunately, remains very low. And that's one of the reasons why we're doing this show is to kind of raise the awareness about what this is. And so therefore, you can kind of start thinking about this and making ways to avoid getting those bites. And early recognition can prevent unnecessary suffering and dangerous allergic reactions. So, if you find yourself reacting strangely to meat, mammalian meat products, then this might be one of the things you might even want to, say, hey, every time I eat burgers, now a couple hours later, I get this nausea, diarrhea, and I've never had it before. You could bring this up to your your clinician and say, hey, is there any chance I could have alpha gal? I go out and hunt. I go out and fish. I'm out in the woods a lot. This is one of those moments where increasing knowledge can actually help you prevent unnecessary suffering, because if you know that's what it is, then you can work your way around that. Okay, so remember, knowledge is always power. Knowledge is always power. So for today, we want for today's show, there are a couple of things we want to really have you take away. These are going to be 5 things you can start doing today to minimize your chances of developing this alpha gal syndrome, which of course a lot of this is going to surround avoiding that tick bite in the first place. So the 5 things you can do today: number 1, learn tick prevention. So learn tick prevention. And this is something of course, online, you can always look at that. But also health departments, go talk to your health department. Say, hey, do you have material for preventing tick bites? Talk to them, see if they might have some material, or they might have some either material for learning, or they may have some stuff that you can maybe take and say, if you got a camp or something in nature, they might have stuff that they can provide to you to help you prevent tick bites, not only amongst yourself, but maybe amongst your campers or your family, things of this nature. So that's one source of this one great place to get a lot of good information from. So learn tick prevention, because you want to avoid bites whenever possible. Number 2, you want to check yourself after outdoor activities. Don't wait until the next day. You want to check yourself after the outdoor activities. So when you come inside, whether if you got a garage, maybe out there, or like I said, mud rooms and stuff of that nature, or just like I said, on the porch, just kind of check yourself and check and see if you see any ticks that may be crawling or anything of that nature. So don't wait until the next day. Don't go in and go to sleep. Check yourself before you go in the house. Know the symptoms, especially delayed reactions after eating meat. So if you notice some, some stomach upset, some rashes that seem to occur that you haven't had before, and like I said, you're a person that goes outdoors a lot, then add alpha-gal syndrome to the list of things you can be thinking about. Talk with your doctor if you're having these unexplained allergic reactions. You're trying to figure out what's going on there. Yet again, bring this alpha-gal to that conversation, so that that's something you could be looking for, right? And consider healthier protein choices. All right. So this is we're always going to push healthier protein choices. We're always going to push, whatever we think is going to help you in the long haul. So plant-based proteins, fish can have overall benefit in the first place. So of course nobody wants to hear that. You don't want to get alpha-gal. No, they have to make this switch. You want to do it on your own. But like I said, it's just something to think about, right? Okay, so and think about this. I mean, suppose you suddenly became allergic to red meat tomorrow, right? What kind of foods would you substitute instead? And you can think about doing that ahead of time. Right? So today, if you found today's program helpful, I'd like for you to, like it and share it with a friend, share it with your church, share it with your family, or share it with your social media friends. If you find this thing helpful, like I said, let us know. And like I said, I would like to, as we kind of get ready to wrap this up, I'd like to thank everybody that's watching online. I'd like to thank everybody that's listening on WVOE. Everyone that's watching the live stream, everybody that's watching the recordings. We really appreciate you sharing your attention, because that's really what you're doing. You're sharing your attention. You're following the show. So feel free to like, share, and follow PressureMD Academy. And let us know that how we can serve you a little bit better. Okay. So if you have concerns about blood pressure, kidney disease, lifestyle changes, like I said, I'm not your doctor, but I'm a doctor, but I'm not your doctor unless you sign up. So make sure you talk to your primary care clinician about any issues you may have, any questions you may have. Feel free to reach out to us at PressureMD as well. And remember, you cannot manage what you do not measure. So know your numbers, know your blood pressure, know your kidney numbers, know the risk around you. So thank you for joining me for another episode of Health Facts. I'm Dr. Christopher Brown. Remember, your health is one of your greatest assets. Invest in it every day. So until next time, stay informed, stay healthy, and take control of your health. Take care.
And all right, ladies and gentlemen, that was Dr. Christopher Brown here at WVOE.